Hi, I'm Dr. David Gross, psychiatrist.
And I'm Dr. Andrew Rosen, psychologist, and welcome to Two Shrinks
with Anna Mike. We thought we'd continue our discussion about this concepts of obsessive compulsive disorder and obsessive anxiety disorders because of how broad and important an area it is. We really haven't talked about one aspect of it, and this is something that I find very interesting. I see a number of individuals who come into my office saying they think they have attention deficit hyperactivity disorder. You know, when people look at me up online, they see that I have a lot of interest in ADHD and treat a lot of adults with ADHD. So they'll come in thinking that they have attention deficit disorder, and I'll ask them, tell me what makes you think that? Well, they'll say, I can't finish projects, and I get easily distracted, and I stare out into space at times, and I get stuck in my head. And, you know, theoretically, ADHD is a disorder that starts in early or late childhood or really early teens. And generally speaking, it's not something that starts in adulthood. And so I'll ask people to be more specific about what they mean by that. And a lot of them will then begin to talk about the fact that they get stuck in their heads with lots of what if this, what if that thinking, and that distracts them from the world around them. And that distraction, it makes what I call pseudo-ADHD the issue. They don't really have true attention deficit hyperactivity disorder, but what they're dealing with is an obsessive anxiety disorder that they really haven't been able to get a handle on.
Yeah, imagine, and it could be in everyday kind of situations. Imagine, while we're doing this podcast, if I had the thought that maybe I parked in the wrong space and I might get my car towed. Well, if that's playing around in my thoughts, it might be hard for me to focus and concentrate on our conversation. And there's so many examples of that where our brains are kind of in two places at the same time. And we're focused on one thing externally in the situation, but our thoughts might be somewhere else. And that is what goes on with ADHD, but it also is what goes on with this overthinking, obsessive mechanism that is associated with anxiety.
You shouldn't have reminded me. I did park my car on the wrong spot today, and did have a little bit of a worry about getting either a ticket or towed, but not enough to get in the way of
See, I'm a mind
being able
reader
to
too.
come in here to provide this podcast.
I knew you were thinking that.
But you know, it's individuals often believe that it's a lot easier if I have ADHD because here's a pill and I'm fine. And goodbye, and don't need to come back again. And I wish it was that simple, but it's not. But once I begin to help them understand that this is really an obsessive what-if anxiety disorder that gets them stuck, then they're beginning to have to think about the need for a different form of treatment. Medication can be helpful for obsessive anxiety disorders. We do know that the medicines that work on serotonin tend to have anti-obsessive properties. And the antidepressants that we use most commonly this day and age, which are the SSRIs, the selective serotonin reuptake inhibitors, examples of which are Prozac and Zoloft and Celexa and Lexapro and Paxil, are very effective for this type of problem. But also the serotonin norepinephrine reuptake inhibitors tend to be effective as well. From my perspective, biochemically, it becomes a bit more confusing because the serotonin norepinephrine reuptake inhibitors also have a norepinephrine component, and I don't think we really understand yet whether or not the norepinephrine contributes itself to anti-worry, anti-obsessive benefits. But these antidepressants are prescribed successfully for obsessive anxiety disorder and obsessive compulsive disorder, and the FDA has approved some of these for OCD. Individuals then get confused and puzzled as to why I'm prescribing an antidepressant, and I have to explain to them that you don't have a primary depressive disorder. It may be true that your obsessive anxiety and your OCD symptoms are wearing you down and getting you depressed and getting you unhappy and getting you frustrated in life, but I'm giving you these medications to help you with the obsessive anxiety and the OCD type anxiety. But I let them know right from the get-go that this is not a silver bullet. It can help prepare your brain for the cognitive behavioral therapy that needs to ensue. The way I describe it is to let people know that it builds a foundation upon which you can then do the cognitive behavioral work. It makes it easier to do it. I do tell people that if they say to me, Doc, I'd really like not to be on the medication, I tell them I respect that. And you could pursue the cognitive behavioral therapy without the medication. I'm okay with that, and as long as you see somebody who is a cognitive behavioral maven, I'm perfectly fine with that. The only thing I ask of you is if your psychologist or your cognitive behavioral therapist tells you that we've done a lot of work together, but you've reached a plateau and you're not continuing to progress, at that point, that I'd like you to reach out and let's talk about adding medication to help increase the success and the ability to get an outcome that you want for yourself.
You know, it's really difficult for us very often to make a decision as to whether or not this person is primarily suffering from ADHD or is it an anxiety disorder. And it's that much more difficult for the person who's got this problem to decide, is this anxiety or is this something else? But the common denominator is that the person will typically say, I can't shut my brain off. It's always thinking about something or something that's extraneous or not what I'm trying to focus in on. I just can't shut it off. It's always going somewhere. And that's a common denominator for certainly for ADHD and for anxiety. And, you know, very often over the years, we've seen people who come in with a diagnosis, a pre-existing diagnosis of ADHD, and then we will look at them and say, well, wait a minute, you know, you've only gone so far with your treatment for ADHD, whether it's medication or not. Why don't we look at anxiety medicine, including an antidepressant? And very often that makes the difference, and vice versa. Sometimes somebody will have the diagnosis of anxiety disorder. They may come in with it from somebody that's given it to them, or we may see it, or the patient may think that I have anxiety, and it turns out it's because of ADHD. Because if you have ADHD and you can't really stay focused, and you have a lot of things on your radar screen, and you know you have too much going on, that's anxiety provoking. How can I be managing everything when I can't stay focused on anything? That creates anxiety. So very often the ADHD and anxiety disorder issue come together, and they're very often not separate. Most people, I think, will have some kind of hybrid. And so it, again, like we were talking before, it takes a lot of expertise and experience as a clinician to know how to differentiate these two things and put together a plan to address both components sometimes.
You know, if you talk to pediatric child mental health professionals, they'll often tell you that they see a common combination of obsessive compulsive disorder and ADHD in these kids. And I see them when they grow up and become young adults and adults. And there is a big comorbidity, a common overlap between the two. One of the ways that I try to separate the obsessive anxiety thinking of OCD from what can occur in ADHD is the individual with attention deficit hyperactivity disorder will describe a busy head, almost like racing thoughts. So they're not reverberating loops. It's not, you know, the old days of having a vinyl disc that you play on your turntable and it gets stuck in a particular channel and it's just repetitive. That's what the OCD anxiety is like. It's repetitive, cyclic thinking, whereas the attention deficit hyperactivity disorder thinking is often just a mishmash of racing thoughts and nothing specifically that is broken record thinking as in OCD. And it's helpful to really differentiate the two. What a lot of people describe who have ADHD, and this will be a topic we'll talk about in the future, I'm sure, is that once they get on medication for that, suddenly their brain is quiet. So it's almost like static with ADHD versus a broken record for obsessive compulsive disorder.
And the hard part is, you know, you can have both. I mean, it's just like we can have a stomach problem and a back problem. I think some people can have both ADHD and an anxiety disorder that interact with each other. And then the treatment is really very important to come up with a good plan, because you could be the person who goes to somebody and they say, oh, it's ADHD, let's treat your ADHD. And it can sort of partially get better, but not fully. And you wonder, well, maybe it's who knows? Maybe it's the medicine or something. So they didn't get really much better because the other component, if they have anxiety disorder, wasn't addressed, and vice versa. So it's a significant problem, and I believe, I don't know if we have any data to support it yet, but with the overuse of screens, where everything is two-dimensional, the person with ADHD, I think, will have a greater problem in differentiating stimuli. And I think the person who has anxiety disorder will also have that problem because looking at a screen or two-dimensional, we're starting to find out, and you know more about this, David, than I do, about how the brain works differently in two-dimensional stimuli. So you put all that together, and I think you're going to get an increase in the population where you have both these problems together.
Well, you're also raising the concern that a lot of mental health professionals have about the impact over time of internet and cell phone preoccupation impacting how the brain functions, because we're retraining our brain for 10 to 20 seconds of information, and all of these websites have been developed so that basically you can scroll from one thing to another. So the idea of spending 10 minutes on a topic is no longer present. So the real fear and concern is, will the brain of a 15-year-old 30, 40 years from now be different in how it functions from a brain of a 15-year-old in this modern times, because we're going to be changing the way our circuitry works. And you add to that the whole concept of artificial intelligence. I know we're getting off on a bit of a philosophical bent, but it's important. Artificial intelligence may get people to begin to use that for reasoning rather than using their brains. And what happens when you don't use an organ? It doesn't work as well in the future, and you begin to get atrophy and loss of use. And that's a real concern. For all of you who may have seen that movie WALL-E from years ago, it was a cartoon about what happened to the Earth after we polluted it so badly that we had to send robots automatically down to the surface to clean it up. There were scenes in there of people living in huge space stations in anti-gravity wheelchairs, basically, who didn't do much of anything. They everything was solved for them, and they basically, their brains were useless. And that's a bit of an exaggeration, and I don't get people scared, but there is a concern for the future.
Well, there's a term that they use in all of this called an algorithm, which it means that a lot of these websites and electronics have algorithms which get you to keep tuning in and giving you more information that you'll want to see. And, oh, yeah, that looks familiar. That makes you want to keep going. And, it's like, why don't they just call it addiction? Why don't they just call it a drug rather than an algorithm? Because it is a drug. It's addicting. And so, the effect that it has upon the ADHD brain or the obsessive brain is going to be different probably than the person who isn't susceptible to that as much, like somebody who doesn't have ADHD and somebody who doesn't have an obsessive disorder. But I think we probably ahead of the curve in our discussion today about it. But it's important because we're discussing ADHD and or anxiety disorders, and lots and lots and lots of people out there will have some exposure to it or have some of it. And our job as professionals is to educate and to hopefully come up with good treatments. So that's why we're talking about it.
We really can't finish a discussion about OCD unless we talk about one of the worst aspects of OCD and most painful aspects of OCD, which is the presence of what we call horrific thoughts. I know we mentioned that the last time, but basically horrific thoughts are intrusive, horrible thoughts that are very scary. They related to either danger, like I could do something bad, I could harm somebody, or health. Do I have a cancer inside of me? And I have these thoughts that pop into my head telling me that I have this. And oftentimes when people have horrific thoughts, they're crazy. And they misinterpret the horrific thoughts for even hallucinations. It's almost like somebody's talking to me, telling me that I'm going to pick up this knife in a business meeting and stab my neighbor. And they're terribly frightening. And because they're so scary, people often keep them private to themselves, fearful if I tell anybody, they're going to tie me up and take me away to a mental hospital. But these are aspects of OCD that can't be ignored and need to be addressed.
There's another piece to that as well, that in these horrific thoughts or intrusive thoughts, very often there's a shame and embarrassment feeling and a feeling of, I'm a bad person. I must be a bad person to have thoughts like this. And the quandary is, how do I find out if I'm a bad person? I can't tell anybody because that may get everybody I know to know I'm a bad person. So how do I deal with the fact that I might be a bad person? Well, maybe I can find a way to not have these thoughts anymore. If I cannot think these things, then maybe that means I'm not a bad person. Well, of course, none of us can control our thoughts. And typically the thoughts that we don't want to have are the thoughts that will occur faster. And so very quickly a person can feel like not just scared about what might happen, but feel like they're a bad person and they shouldn't be here any longer, that they don't belong here. And then that opens up the whole issue of self-worth and self-harm and suicidal thinking, which then unfortunately interfaces in our current world with AI and some of the horrific things we've heard about people listening to AI. It can be really tough.
You know, the aspect of horrific thinking that is needs to be shared with individuals, the fact that you're really looking at something that's brain static. I use the analogy of dreaming at night. When you're in the middle of a dream at night, it's very, very real. You don't second guess it, even though it's a supernatural type of dream and things are happening that make no sense in real life, but you're in the middle of the dream. You wake up in the morning and you realize that this was just a dream. But what it was a manifestation of how your brain is working at night in a very normal way. Well, horrific thoughts probably represent brain static in certain areas of the brain that generate these thoughts when they shouldn't be generated. It's almost like a belch that you don't have control over. And it doesn't help decrease the thoughts themselves, but for somebody to recognize that this is a manifestation of my brain and it's not part of who I am or what I will do, terribly important, because that helps to some degree normalize it, and then it can be addressed in treatment.
Unfortunately, and you brought up the issue before of some of our older theories, our psychoanalytic theories. Do you know, and when I was in my psychoanalytic training.
It's not your mother's fault.
It was all my mother's fault. But very often it was, if you had a thought, a dream, particularly an upsetting dream, if you had a particular thought, the idea was it may be not just a fear you're having, but it may be your wish. So if you had a dream about, somebody that you loved was killed in an accident, very often the interpretation was it's a manifestation of your anger towards your whoever. And what? I don't want anything bad to happen to her or to him, but that was the orientation then that would make a person kind of believe that. Now, we know that's nonsense now, but that wasn't too long ago that was a real part of our therapeutic understanding of people. So obsessive compulsive disorder and the thoughts you have, whether they be in your dreams or the intrusive thoughts, it's an aberration. It's a glitch in your brain. It has nothing to do with who you are, what you want, what you don't want, or anything other than it's just a thought. And most thoughts that we have, especially in our sleep, are nonsense, and I call them junk thoughts. So today I call them spam. We get all these phone calls that come through, and sometimes it's labeled as spam, and we dismiss and disregard them. We don't pick up the phone. Same thing with thoughts. These are spam thoughts, and we're best off just knowing that and just disregarding them.
The reality is that we have parts of our brain that prevent these types of intrusive thoughts and do a very good job in inhibiting them. The individual who has horrific thoughts, that part of the brain or those parts of the brain not doing an adequate job in preventing them. And with that, hopefully you'll send your questions to us and raise concerns so we can learn from you all. But I'm Dr. David Gross.
And I'm Dr. Andrew Rosen, psychologist, but I just wanted to add one thing. I always tell people that you can't make yourself not think a thought. It's only when you kind of get distracted with a conversation or move on to something else that you forget, that idea of don't think about purple elephants. Well, it's only, you'll stop thinking about them when you're doing something else. But I was just thinking probably you forgot about your car until I reminded you right now.
That is true. Thanks.
So I'm glad we were able to do this podcast today at Two Shrinks and a Mic, and we'll see you next time.
Bye-bye.
The Two Shrinks and a Mic podcast is for informational and entertainment purposes only. The views expressed are those of the hosts and guests and do not constitute medical, legal, or professional advice.
Please always consult a qualified healthcare provider before making any medical or wellness decisions. Our content is not a substitute for professional medical guidance, even though our mothers tell us we have the best advice possible.